Oral chemotherapy. Introduction. It is always possible to determine the cause of cancer in a patient. Select true or false. Correct. It is usually impossible to specify the causes of cancer in an individual patient, but we do know what can cause cancer in some people. Cancer cells divide faster than healthy cells. Select true or false. Correct. Chemotherapy interferes with cell duplication. Since cancer cells divide more rapidly, they are the targets of the treatment. If you miss a scheduled dose, you should add it to the dosage of the next day. Select true or false. Correct. If you miss a dose, do not double or add it to the next day's dosage. Red blood cells, or RBCs, white blood cells, or WBCs, and platelets are sensitive to chemotherapy. Select true or false. Correct. Anemia happens when red blood cells, or RBCs, decrease significantly. Select true or false. Correct. Anemia makes the patient feel very tired and sometimes short of breath. Patients undergoing chemotherapy treatment cannot exercise. Select true or false. Correct. Patients undergoing chemotherapy can exercise but should avoid activities that may increase the chance of bleeding. Hair loss during chemotherapy happens only on the scalp. Select true or false. Correct. Hair loss may affect the entire body and may be rapid. Drinking clear liquids may help decrease the symptoms of nausea and vomiting during chemotherapy. Select true or false. Correct. Thank you for using Explain.